Hi, and welcome to From Bump to Baby. My name is Ruth Godoy, and I'm a genetic counselor. Every pregnant woman has taken a pregnancy test, but today and over the next 5 videos, we're going to talk about another type of test that more and more pregnant women are taking, a genetic-based test, so that you are well prepared for the months and years to come. In this video, we're going to talk about a specific type of genetic screening test known as non-invasive prenatal test, or NIPT for short, and whether it might be right for you and your baby. By the end of the video, you'll understand the difference between a diagnostic and a screening test, the definition of an NIPT test, and a basic overview of genetics. Let's start with genetics first. Every cell of the human body has something known as a nucleus. Within the nucleus is deoxyribonucleic acid, or DNA for short. DNA is composed of very long strands of molecules, known as nucleotides, arranged in base pairs, which form the DNA double helix. This long double-stranded strand gets packaged into smaller structures known as chromosomes. Normally, our cell contains 46 chromosomes, or 23 pairs of chromosomes, and for each pair, we inherit one from our father and one from our mother. The last pair is referred to as the sex chromosomes, where you typically inherit 2 X chromosomes if you're female and 1 X and 1 Y chromosome if you're male. However, humans do not always have the same number of chromosomes. When someone is what's known as euploid, they have the usual number of chromosomes, 23 pairs, so 46 individual chromosomes. When someone is aneuploid or has aneuploidy, however, they have a number of chromosomes that is different from 23. For instance, if someone is missing 1 chromosome, they have what's known as monosomy. So if someone only has 1 X chromosome, they have monosomy X, or what's most popularly known as Turner syndrome, which can cause a number of different medical or developmental problems like short stature, failure of the ovaries to develop, and in some cases, heart defects. If someone has an extra chromosome, or what's known as trisomy, they have additional extra genetic information. An example of trisomy is trisomy 21, or what's most commonly known as Down syndrome, which can cause physical growth delays, learning difficulties, and characteristic facial features. But how is monosomy and trisomy possible? When a baby is conceived, it typically starts with 1 sperm entering 1 egg, where each sperm and egg have 23 chromosomes, making an embryo with a standard 46 chromosomes. In some cases, however, when the female's body makes an egg or the male's body makes a sperm, the chromosomes do not separate evenly and the sperm or egg is missing or has an extra chromosome. In the case of Down syndrome, for instance, either the egg or sperm would have 2 copies of chromosome 21. When combined with their normal counterpart, a normal egg or sperm, the embryo will have trisomy 21 or Down syndrome. As women age, they have a higher likelihood of having pregnancies with differences in the number of chromosomes. This is because unlike men who produce sperm continuously, a woman is born with all the eggs she will ever have, and they age as she ages, which increases the likelihood of chromosomes not separating evenly. So how can a woman know whether her baby may have an extra or missing chromosome? There are 2 types of tests that can help: diagnostic test and screening test. A diagnostic test takes a sample of either the placenta or amniotic fluid to tell with high certainty whether the baby has a genetic disorder. Because diagnostic tests can have serious complications, including the loss of pregnancy, many women choose to have a screening test before a diagnostic test. A screening test can help determine whether pregnancy are at a higher risk of having a chromosome aneuploidy. NIPT is one type of screening test. We will explain later how NIPT fits into prenatal care and how it compares to invasive diagnostic tests. For now, you should understand that NIPT involves a simple blood test taken from mom's arm, which allows us to look at mom's DNA and the DNA from the placenta in order to tell us whether there's a higher or lower chance of the baby having a genetic condition. To find out more about how NIPT works and the differences between them, watch out for our second video in this series. Thanks for watching.